All right, for those of you out there that think this is just a glamorous job and I just can crank these things out left and right, yeah, I occasionally come across a few problems and it sets me back a ways, and then I get to re-record things. Just letting you know that I'm not perfect. Surprise, right? Anyway, getting back to the anticholinergics. Oxybutynin and Ditropan is the brand name. You'll use that a lot for incontinence, overactive bladder spasms. Very commonly used that, very effective. So cholinergic blockers, these decrease muscle rigidity and muscle tremors. It's good for Parkinson's disease and drug-induced extrapyramidal reactions. And what are extrapyramidal symptoms? Akinesia or difficulty walking, rigidity, tremors, pill rolling, a very mask-like face, shuffling gait, muscle spasms, drooling is a big one. It sounds just like Parkinson's disease, doesn't it? If you've ever met a person who has advanced Parkinson's disease, it looks like they have no emotions to their face. Constantly doing this. And it's hard for them to get walking. And once they get walking, they shuffle, and it's hard to stop, and frequently then they fall. Excuse me. Cholinergic blockers, these have very odd effects. In small doses, cardiovascular, it decreases the heart rate. In large doses, it increases. Central nervous system, small doses, it decreases muscle rigidity and spasms, but in large doses, it causes drowsiness, disorientation, and hallucination. In the eye, it dilates the pupil. So we can go over all those drug effects in class. Contraindications, obviously if there's glaucoma or asthma, you're going to use these very carefully. Acute cardiovascular instability, so a person just recently had a heart attack, you be very careful with that. Nursing implications. As nurses, we always assess constantly. So we're always going to be assessing the patient if there's been improvement or worsening after giving medications. We're going to look for allergies and benign prostatic hypertrophy. We're going to look for, make sure this glaucoma is under control. Bradycardia and tachycardia, heart rate. Have they had a heart attack or do they have CHF? It may cause blurred vision. They may experience sensitivity to light and want to wear sunglasses. When you give eye drops, after you put the eye drop in, you're going to hold pressure on the inner canthus, and that will eliminate or reduce the chance of systemic absorption. Have physostigmine available as an antidote for atropine overdose. Hopefully with Parkinson's we'll see fewer tremors and decreased salivation. Peptic ulcer disease, we should have decreased abdominal pain, urologic problems, improved urinary patterns. When we're working with the elderly, the geriatric population, we need to be aware that these patients, these residents, our clients that are old, will be much more sensitive to any of the effects. They are more likely to have side effects and adverse reactions and have symptoms of overdose much easier. So regardless of the medication, they're more sensitive to the effects. Adrenergic, they're more likely to have excess cardiac and CNS stimulation. The adrenergic blockers, much more likely to have falling episodes related to hypotension and decreased cardiac output. So they need to change positions slowly. Cholinergics, side effects, more likely to have diarrhea, increased secretions, and bronchoconstriction. Anticholinergics, hyperthermia, a greatly elevated temperature, urinary retention, and decreased appetite. Those symptoms, those side effects are common for many medications, and the elderly take many, many medications. It's not uncommon for people in nursing homes to take 14, 16, 18 medications in the morning. It's a lot of medications. So as nurses, we have to constantly be aware of what are they taking, why are they taking it, what are the side effects we need to watch out for, What are the therapeutic effects that we're hoping to see? And if we stop seeing therapeutic effects and start seeing more side effects, we need to notify the doctor to maybe change medications, change doses, find something else that'll work. Our job as nurses is to be the eyes and ears of the doctor, because doctors spend very few minutes with the patients and we spend a lot of time with the patients. So always know what can happen when we give those medications. This class is all about safe medication administration. We need to know what we should see, what we shouldn't see, and when to expect those things to happen. Now, I went through these 52 slides relatively fast. We'll talk about these in greater detail on Monday. But what I hope, and I've said this before, I hope you come to class with questions. Write down those questions. Ask them in class. When you ask a question, I can give you the exact answer, the exact information you need. If you don't ask questions, I'm going to give you all this information and you may already know it. And it'll waste your time, my time, and everyone's time. So bring your questions to class. Bring your confusions to class. What are you confused about? I want to go over that and make sure we understand that completely. Be prepared to talk, participate. This is a complex topic. It's an important topic. It affects so much of the person. And we'll be dealing with these medications throughout our nursing career. It's important we know these thoroughly. On Monday, we will also talk about the test in broad terms. I'm not going to talk about specific questions unless these questions cause a lot of confusion. If someone in class, if any one of you want to go over your test in detail, we'll make an appointment. We'll go over it question by question. But in class, I'm going to talk in broad generalities and make sure that we understand where we missed and what we can do to correct it. And remember, if you scored less than 82, be prepared to make an appointment with either me or Maria to go over the test in detail and come up with an action plan on how to improve your score on the next test. Okay? Look forward to seeing you on Monday. Have a great weekend. Study, study, study. Do your quizzes. Do your study guides. Bring them to class, and we're gonna tackle this topic, and we're gonna do great. We'll see you on Monday. Bye.